I'm delighted to be here to have the opportunity to open the Private Hospitals Association's annual conference and to wish you very well with your conference. I know you have an exciting agenda ahead and a number of very distinguished speakers, both domestically and indeed internationally, and I'm sure you look forward to those deliberations as well. Let me start by stating that as Minister, I'm keenly aware of the important role that your hospitals play in delivering care to patients right throughout this country. And I'm also conscious that frontline staff and frontline managers, wherever they work, be that in a private hospital or in a public hospital, have at the core the very same goal. That is to deliver safe, effective, timely care to patients in a dignified, respectful and sympathetic manner. And just maybe perhaps, Bill, to start by addressing the points you've raised with me before going into my script. In relation to Sláintecare, we now have, after 11 months of deliberations, we now have a cross-party plan for the health service for the next 10 years. When I took up office a year ago, I made it very clear that we could not have a situation where every time the minister changes, the plan changes. Now, of course, the minister didn't change, but every time the minister changes, the plan can't keep on changing. That leads to widespread confusion. It has hampered the development of the Irish health service over absolute decades, with politicians playing politics with the health service. And every time the government changes, the minister changes, an election happens, there's a new plan, a new big idea to fix the Irish health service. And while Sláintecare is not the answer to all our problems, it is a very honest attempt to grapple with a number of the serious challenges and questions that we face in relation to our health service. And today, in fact, after I leave here, I will go to Cabinet and to give Cabinet my initial feedback in relation to Sláintecare and to inform Government that I intend to come back to Government with an implementation plan for elements of Sláintecare in the coming period of time. In relation to capital investment, I couldn't agree more. This country has been starved of capital investment as a result of the deepest and darkest recession. And whether it's in healthcare or indeed any other element of service delivery, we need capital, and we need as a country to look at new and creative ways of providing capital investment. And I know my colleague Minister Donoghue is very proactive in relation to that. Regarding the NTPF, let me be very clear, the NTPF is here for the foreseeable future. I know when I met the Private Hospital Association shortly after I took up office, one of your requests of me, and indeed one of the NTPF's requests of me, was the need for certainty. We cannot expect people to gear up for 1 year and then not know what's going to happen next year. And that's why in the budget negotiations, I secured not just funding for the NTPF this year, but actually a commitment already to the funding for 2018. So there can be no excuses now. The NTPF knows what level of funding it's going to have in 2018. It now has a new permanent CEO in Liam Sloyne, an excellent individual. It has a fully complemented board, and it's going to get on with that job now. And I think that provides certainty to your hospitals. I think it also provides certainty to the NTPF in terms of the body of work that they need to undertake as well. And in relation to the disentanglement of private versus public, which is a key recommendation of Sláintecare, and indeed something that's been the subject of much public and media debate in recent weeks and months. I think this is one of the areas we need to look at early on in any implementation plan, and I think we do need an independent impact assessment of this. We already know the private income in public hospitals generates about €650 million a year. That's a very sizable amount of money, so we do need to grapple with that question. But I agree with your sentiments. We should grapple with it early on in the process, again, to provide certainty to all involved. So, ladies and gentlemen, when it comes to business, any business, and particularly attracting new business to Ireland, we've been quite good as a country and as a government of taking a Team Ireland approach. And I would suggest here today that some of that same type of whole system approach is required in delivering health services for patients in Ireland. We put on the green jersey to support Ireland in sport. We've put it on in recent years to support Ireland in terms of our economy. And I would argue that it's now time we put on the green jersey to try and support the Irish health service as well. What does that mean in a tangible, real sense for Irish patients? It means unapologetically using every ounce of capacity we can find in terms of the delivery of health service, be that in the public service, be it through the public health service, funding services in private hospitals or voluntary hospitals. It means unapologetically looking at every innovative and creative way we can to provide services to patients. Because when I meet patients on waiting lists, waiting long lengths of times, they don't want me to get involved in a big ideological debate with them. They want me to tell them when they're going to get their operation. They want to know when they're going to get their procedure, when their pain is going to be eased. And that's why I think whilst we plan, and I'm absolutely committed to the creation of universal healthcare in this country, but whilst we are on that journey, we must use every single bit of capacity at our disposal, and that includes utilising the resources that are available in your hospitals as well. At present, it's clear that our health service faces significant challenges in meeting the current demand, but also the forecasted future demand for healthcare in Ireland. And private hospitals do have a role to play in helping us all meet this demand. With regard to the potential contribution of private hospitals in the area of emergency care, under this year's winter initiative, opportunities were sought to utilise capacity in the private sector to alleviate ED overcrowding. Specifically, we saw the minor injury service in Smithfield. We also saw the utilisation of some bed capacity in private hospitals. I think it's fair to say we can both do better in this regard, but we'll only do better if we have honest dialogue and earlier dialogue. And I know that my department is continuing to explore with the Private Hospitals Association the contribution of private hospitals in alleviating ED overcrowding in public hospitals. In addition to that, though, I think there is a huge amount that many of your hospitals can do and are willing to do in relation to meeting the demand for elective procedures. Reducing waiting times for the longest waiting patients is one of this government's key priorities, and consequently the last budget allocated €20 million to the NTPF, which, as I've already said, will rise to €55 million in 2018. My department will continue to engage with the HSE and the NTPF to ensure that this funding is spent to deliver timely, cost-effective and appropriate care to those patients waiting the longest. I think it's really important that we look at this. We see an awful lot of media headlines and media discussion and political discussion about the total number of people on a waiting list. But again, if we take it back to our own lives or our own family's life, it's not being on a waiting list, it's the length of time you're on a waiting list for. And that's why, again, I will be unapologetic in my demands of the NTPF and the HSE in working with your hospitals that it is the longest waiters that we target. It is not acceptable that people are waiting so long. And what we will not have, which we did have in the past, we will not have cherry picking of patients. We will tackle the longest waiters based on the acuity and based on their need as well, not those that are easiest to pluck off a list, which I think is something that we did see in the past. And as I've already said to you, and I think it's an important message to relay at your conference, the NTPF is back. It is back in business, and it will have a role to play for the foreseeable future in terms of helping us utilise all capacity, public and private, to drive down elective waiting lists and times on those lists as well. I would today, though, at your annual conference, like to note the positive efforts of Ireland's private hospitals in the sphere of patient safety. Last December, I was pleased to be able to launch the National Patient Safety Office. This new entity is an integral part of the Department of Health. It will drive new developments in patient safety policy and legislation. It will establish a patient safety surveillance system, and it will continue to promote the clinical effectiveness agenda. I know that there are a number of initiatives underway in relation to both quality improvement and patient safety in the private hospital sector, including, for example, the voluntary adoption of the national standards for safer, better healthcare. The engagement of your members with the National Clinical Effectiveness Committee, both at committee and subgroup level, does augur well for the continued work in relation to the implementation of the National Clinical Guidelines and National Clinical Audits, and that I endorse for implementation across our whole health service. I'm also sure that there are areas where the public and private sectors can learn from each other's systems and each other's approaches. One important issue, for example, relates to the need to distribute learning across the system and how best to foster that learning. My department is also emphasising the need for greater degrees of transparency. We can see the fruits of this change with the publication now of monthly maternity patient safety statements since December 2015 by all maternity hospitals and maternity units. This is now being followed by similar monthly reports from all hospitals. The National Patient Safety Office is also bringing forward provisions to support open disclosure of patient safety incidences in both public and private settings. Again, so important. In this country, the culture that has been created is wrong. When I meet patients who have gone through a grievance in relation to a hospital, be it public or private, often one of the first things they say is, I just want to know what happened. I just want to know the facts. When I meet clinicians, as I did yesterday, they often say the same thing to me as well. I just want to be able to tell the patient. I want to be able to engage and say, here's what happened, here's what went wrong, here's what's going to be learned from it. And the system whereby the legal system kicking in before that opportunity has been afforded to both the clinician and the patient and the family has been a huge problem. So the inclusion of the open disclosure provisions in the Civil Liability Amendment Bill, which is currently making its way through the Oireachtas, should help in this regard. And this bill is part of a broader package of reforms aimed at improving the experience of those who have been affected by adverse events. I've also recently approved the national standards for the conduct of reviews of patient safety incidences. These standards, developed jointly by HIQA and by the Mental Health Commission, aim to promote a framework for best practice in the conduct of reviews of patient safety incidences, and they intend to set a standard for cohesive, person-centred reviews of such incidences. The development of these standards will form a firm foundation for continuing improvement in patient safety and quality across the health service. Many of you here today will be aware that my department is now working on legislation for the mandatory licensing of hospitals, both public and private, and high-risk clinical activities provided in other settings. Licensing of public and private hospitals will be a new departure for this country, and I know that the licensing proposals have been welcomed by the Private Hospital Association, and I thank you for that. Ensuring good governance is a major focus of the proposed licensing framework, and a key objective is to improve patient safety by ensuring that healthcare providers do not operate below core standards set under regulations and applied in a consistent and systematic way. A stakeholder group, which includes membership from your own association, has been inputting into work on the proposed licensing legislation, and the association has played a very active part in this group, and I thank you for that. Work on the general scheme is now well advanced, and this morning I wish to inform you that I intend to bring the general scheme of licensing legislation to government in early autumn for the formal drafting of the bill, and I also intend to ask the Joint Oireachtas Committee on Health to examine the general scheme. Licensing is part of a phased approach to better regulation of hospitals, and the association has been equally supportive of other proposed legislation which will be part of the lead-in to the new licensing system. HIQA is to be the licensing authority, and as part of the phased approach to introducing mandatory licensing, HIQA's remit in regard to setting standards on safety and quality of clinical health services, monitoring compliance with those standards, carrying out investigations, will be extended to the independent healthcare sector as well. And this will be done under the Health Information and Patient Safety Bill. I know that the association has been proactive in preparing for this important extension of HIQA's remit. And I know too that prior to this development, the association was part of the advisory group convened by HIQA during HIQA's development of the national standards for safer, better healthcare, which you've adopted in a voluntary fashion as well. In order for all of us to have a vision for our health service, we must first understand the capacity in and the demand for our health services. As such, we have now commenced in the department a capacity review earlier this year in line with a commitment in the programme for government. Unlike previous reviews, it is intended that this review will take a whole-of-system approach and will examine key elements of primary and community care infrastructure in addition to our hospital facilities. It will also look at capacity not just now, but capacity for the next 30 years. I think these have been the two failures of past reviews. The fact that we've only been looking at the acute hospital setting, whilst at the same time talking about a decisive shift to primary care. We've got to once and for all put data and evidence behind what a decisive shift to primary care can look like in terms of impact on required capacity now and into the future. And secondly, we've got to understand when calculating capacity that it's not a static thing. This country's population is continuing to grow, but from a demographic point of view, our people are getting older and we're seeing a significant increase in chronic diseases as well. So this capacity review will look at demographic needs now and into the future in a way that perhaps the health service has not adequately done to date, and it will examine those new models of care, including primary care, on capacity needs. The review, very importantly, will be supported by international expertise and will provide us with, as a country, very, very clear evidence-based data in terms of understanding the capacity needs of our health service over the next decade, and indeed well beyond that, out to 30 years as well. I intend that we will have the capacity analysis fully published this year, and that we will have enough of the process completed in time for the mid-year capital review, which I expect to take place in early autumn. Finally, I just want to return to the recent final report of the Cross-Party Committee on the Future of Healthcare. This committee, as I said, was set up last year and was one of the first actions I took on becoming Minister for Health. The establishment of the committee was supported across the Dáil by all parties and none, demonstrating a shared understanding of the scale of challenges facing our health service and the recognition of the need for a fundamental reshaping of our vision and our long-term strategy for healthcare based on cross-party consensus. I've consistently supported this process, which I firmly believe can provide a once-in-a-generation opportunity to transform our health service. The committee process also included a huge level of engagement with stakeholders, with healthcare professionals, with academics and with interested parties, indeed including your own association. The level of interest and constructive input into the committee's work demonstrates the appetite nationally for reforming and improving the Irish Health Service. And I would echo and endorse the words of our new Taoiseach when he talks about so many challenges this country has met when it's put its mind to it. Why can we not do it in relation to healthcare? And of course we can do it in relation to healthcare. And I think Sláinte Care has lived up to its mandate, the committee has lived up to its mandate, and I want to commend all members on their significant achievement in developing and indeed in agreeing a future vision based upon political consensus. Not an easy thing to do for our health services. The report is a culmination of a year-long process of unprecedented cross-party collaboration, dialogue and engagement, and is a testament to that desire across the political spectrum and indeed the broader stakeholder community to try and get this right once and for all. It does show what can be achieved when you adopt a collaborative, consultative and consensus-based approach, and I have no doubt of the report's importance in the fundamental reform of health services. I will now work with my department quickly on a process of consideration and implementation in relation to this report. When looking through the agenda today in preparation for the event, I was particularly interested to see the title of your mid-morning session, entitled, If I Was Minister for Health. I think there was many people in Dáil Éireann pondering that question last week. And indeed, I'm sure it's a very... You changed it, did you? Oh. I was thinking it was only a very exciting topic because, in all seriousness, when I did see that, what I was thinking was, the question, if I was Minister for Health, really does bring home the point that whilst there will always be one individual at any one time who will be the Minister for Health of this country, if we're serious about tackling the challenges, if we're serious about meeting capacity, if we're serious about reducing waiting times, and I believe everyone in this room is serious, and I'm deadly serious too, it is going to require that collaborative approach. It is always going to require more than any one individual or any one government. Government has a role to play, the Minister of the day has a role to play, but so do all stakeholders. And I'm encouraged in looking at your agenda, and I'm encouraged in my engagement with your association to date by your approach to collaboration, your desire to play your part, and your very clear message to me about the need for us to continue to have honest, open and frank dialogue so that you can plan with certainty for the delivery of your services and so that we can plan as well for our patients. So together, let us do try and put on that green jersey for our health services, work within each of our own arenas, but with that common goal of improving health services for all citizens in this country. I wish you a very good conference. Go